Hi guys, this is Dr. Claudia Kim with New Look New Life Surgical Arts. Today I'm going to be talking about buccal fat removal. So recently, buccal fat removal has become talked about due to social media and obviously with celebrities and the news. So I wanted to kind of give you a short intro and discussion about buccal fat removal and my personal opinion about it. The buccal fat is this area of fat underneath your cheekbone that provides structure to your face. Now, sometimes people with more prominent buccal fat stores, it can make their face look a little bit rounder or fuller. And so the removal of this area can help to define the cheekbones because you're pretty much bringing in this lower cheekbone area to become more streamlined. The way that we do the procedure is we actually make an incision in the inside of the mouth and then we remove out the piece of fat that's sitting right underneath the cheekbone. It is done under local anesthesia. There is some mild discomfort which you can address with local anesthesia, and most people end up taking over-the-counter pain medications, or if you are a little bit more sensitive, you may take a day or two of something prescription strength. The risks of the surgery. So risk of buccal fat removal, obviously you have infections, bleeding. Most dire would be nerve injury where you have weakness, right? Because there are a lot of nerves that are coming down from the area. And so obviously there are the complications that are associated with that. One big issue that I feel with buccal fat removal, and I understand that a lot of young individuals, especially because most people who are younger, they tend to have like chubby cheeks or more of the baby face. And I'm speaking from personal experience. I had a lot of baby fat and a lot of cheek fat, and my nickname was actually Chipmunk when I was a kid because of the fullness of my cheeks. But my personal concern with buccal fat removal is that that actually is your support system for the mid part of the face. And we tend to lose volume as we get older just naturally because we lose collagen, we lose elasticity, and a lot of the times we lose the fat that provides structure to the face. So what I am seeing with a lot of individuals who did buccal fat removal in their early 20s, as they progress into their 30s and their 40s, they tend to look very gaunt, okay? They look like they're very sick, where it's very sunken in because they would have lost that fat anyway, and with the preemptive removal, their face tends to age faster. So it's so common that I see these individuals that they're coming in their 30s or 40s and they're putting filler back in to fill up that space that the buccal fat once resided. Only in certain circumstances I would consider this for a younger patient. However, for the general population, I do advise against it just because our faces are still going through significant changes and development. And so I would be very cautious about entertaining a surgical intervention for that because we like to think of the future. We like to think of you 10, 20, 30 years down the line and not the immediate time. So make sure you find a reputable surgeon and have an honest discussion with your provider. I hope this answers some questions and my personal opinion about buccal fat removal. Stay tuned for other educational videos.